welcome. This is Americans for Prosperity Foundation's Prosperity Update. We're here with Representative David Meeks from Conway, and we're here to talk about the Medicaid Trust Fund. So what we're going to do is we're going to first allow Representative Meeks to talk about the trust fund and give us the sort of the elevator pitch, the short and the long and the short of what it is for folks at home who might not understand or know what it is.
Well, basically what the Medicaid Trust Fund is, it's a savings account for the state, and the purpose of the Medicaid Trust Fund is if we ever have a shortfall in any given year, then they don't have to cut benefits. They can dip into that shortfall, pull the money out to keep Medicaid running without having to cut those benefits.
In a given year, how much money, I guess, two-part question, how much money is there in it, and do we have a statutory requirement for how much we keep?
There's no statutory requirement that I'm aware of for actually how much that we actually keep in there. In any given year, over the past several years, I think, if I remember the numbers correctly, we get about $170 million or so that comes into the trust fund.
Now, if I know my numbers correctly, Medicaid has run a $1 billion deficit over the last 5 years. How does the Medicaid Trust Fund recapitalize itself? I guess where is the main source of revenues, and how are we doing on keeping up with it?
Well, yeah, we've had a lot of expenditures out there now. What most people don't know is that from about 2009 to about 2011, we actually used about $800 million out of the Recovery and Investment Act that was supposed to go to roads to keep our Medicaid program afloat. What it did actually was allow the Medicaid Trust Fund to actually build up to over $300 million in it. So when that stimulus money ran out over the last couple of years, we've actually had to dip into that Medicaid Trust Fund, and at first it was projected that Medicaid Trust Fund would be at zero starting July 1st of this year, but thankfully due to a couple of different things, like the economy picking up and all that, they're projecting that we'll have about $40 to $60 million in that Medicaid Trust Fund at the end of the year.
Now, outside of the stimulus funding, which is what you said between 2009 and 2011, it sort of recapitalized that. Outside of that, how does it generally get funded? Do we have special taxes set aside for that, or is it general fund revenues that get carved out?
The Medicaid Trust Fund builds up with about 9 different taxes. Now there's about 2 or 3 main ones that most folks probably are not aware of. Probably the biggest one that would have a direct impact on consumers is the half-cent soda tax. It's hidden. It goes directly onto your retailers like your McDonald's and your steakhouses and all of that, where they pay a half-cent for the syrup that they buy. And normally they either have to eat it or they will potentially pass it on to consumers through the higher cost. So if you wonder why you have to pay $2 for that drink at your steakhouse or whatever the case may be, part of that reason is because there's a half-cent hidden sales tax in order to do it. There's a quality assurance fee that really, and this really hits the medical field, as well as I think there's like a bed tax as well that hospitals have to pay as well. Those are the 3 big generators for the Medicaid Trust Fund as far as the money that goes into it.
Do we think that the Medicaid Trust Fund right now is in a good place, or do you think we could be doing things better?
Well, I think whenever you drain it down to zero and you've not really done the things that are necessary to reform your Medicaid to keep from having to dip into it, I think we do have an issue. We need to definitely do the Medicaid reform. We started that process this last legislative session. Hopefully we'll be able to continue that. That's going to be the biggest driver because we won't have to dip into the Medicaid Trust Fund if we don't have those particular shortfalls. So we've really got to look at our Medicaid program, make sure we reform that, and make sure that we're balancing that budget, so to speak, so we don't have to dip into the Medicaid Trust Fund. The Medicaid Trust Fund itself, I think, definitely could be run a little bit better. There are, as I said, it's a savings account, but at the same time, there are things that are every year that are taking out of it. There is the private nursing home and the public nursing home. Some money comes out of that regardless of how Medicaid is, whether or not it balances out or not. So that money, they've got money that goes into it, but then money that comes directly out of it. What I would like to see is for it to be a true savings account where once you put the money in, you cannot take it out unless you've drained Medicaid completely. And I would like to even see some kind of legislative oversight when it comes to it as well. Because right now, at any point in time, the Department of Health Services can actually go in there and they can take it out, and then they'll inform us basically that they've taken it out afterwards.
So if I understand the Medicaid reforms that were passed this last session as part of the larger private option package, part of that new 17 to 138% of federal poverty line recipients of new benefits, your 10% highest cost folks in that get shifted back onto traditional Medicaid. Do you think that'll create additional pressure on this, like you said, already, troubled program under Medicaid?
It very well could. I mean, again, when you're talking about reforming our Medicaid system, you're having to look at all the costs, including those that are utilizing it more than others, basically. And you want to make sure that they're not abusing the system and not, and using it properly, basically. That if they do have a medical emergency, that they go get the medical treatment. But if it's not, then they can go to a doctor instead of going to an emergency room, and that would potentially save money. Maybe some home things that they can do at home to not have to run even to the doctor. So those types of things is what our Medicaid director is looking at. Another big thing is the fraud and the waste that we see in the Medicaid. I think the Inspector General coming on board is going to be a big, positive for our state Medicaid. We've seen, in other cases where the Inspector General has done a good job of giving the legislature, not only in the state of Arkansas, but in other states as well, of where giving them a more neutral look at things, with things that are wrong, things that could be actually done better. And so I'm really excited about the Inspector General and looking forward to him, doing his job and giving us a report back so that we can have a really good idea of what changes we may need to make to our Medicaid program.
Sure. Now, as far as Medicaid reforms, is there any additional reforms that you thought maybe weren't addressed correctly, or things that you would have liked to see as part of this broader expansion package, or things that you're looking at in the upcoming sessions?
Well, sure. I mean, you just have to look at other states and see what they're doing. You don't need to reinvent the wheel. Florida has had some really good things with the way that they've reformed their Medicaid. They've done pilot programs in 5 counties there to give people more choice in Medicaid, to set up co-pays, again, to help people use the system a little bit better, even in conjunction with like health savings account as well with the Medicaid program, again, to give people more choice and more power in helping them to learn how to properly use the system. I think that's the biggest thing, is learning to use the system, because a lot of times you're just given free health care and say, okay, so what are you going to do if you've got free health care?
You just walk in.
You're just going to, hey, I've got a sniffle, I've got a cold, I've got this, whatever. You're just going to run necessarily to the doctor. And most folks that are on private insurance don't necessarily have that pleasure, because every time they go to the doctor, they're paying $25, they're paying $50. Sometimes they're paying more if they have the deductible or whatever. So it's basically learning how to properly use the system, learning to say, look, instead of running to the doctor, I can go and get, the allergy medicine, or I can go get aspirin, or whatever the case may be, to help, again, lower the cost and use the system properly.
Sure. Well, I think we're good on the Medicaid Trust Fund. I appreciate you tuning in for the Arkansas Prosperity Update with Representative David Meeks, and look for more of these at the same place.